So the gut is really important for all aspects of health, specifically when we're talking about autoimmune disease like rheumatoid arthritis. There's been a lot of research talking about how gut health may play a role in autoimmune conditions and even in arthritic conditions. There's even been something called the gut joint axis now that people are talking about in the literature. So today we're going to look at a paper that finally links together really well the aspects of gut health and intestinal permeability and rheumatoid arthritis. Let's go. What's up, guys? My name is Richard and this is my channel Evolved Health, where my aim is to educate people on how they can optimize their health, performance, and longevity. If you like the content and you want to support the channel, make sure you smash up the like button and hit the subscribe, and don't forget to hit the notification bell so you don't miss out on any new content. Now today we're going to be diving into this recent paper here. Intestinal permeability dysfunction plays an integral role in arthritis pathology and can be targeted to ameliorate disease. This is a recent one which is posted in July 2021. It's a really interesting paper because they've not only showed the link between gut dysfunction like gut permeability and gut inflammation directly to rheumatoid arthritis, but they've tested it mechanistically. So for a long time, we've known that there seems to be this correlation between autoimmune diseases, of which rheumatoid arthritis is one, with these autoimmune diseases and with gut dysfunction and intestinal permeability or intestinal hyperpermeability. You may have heard this been called leaky gut. So this paper dives in. They look at patients with varying degrees of active rheumatoid arthritis, which is nice, so we can see the link between some key mechanisms. But then they also dive into the mechanisms in a mouse model, where we can look at exactly what is going on with the levels of intestinal permeability, and they also dive into some treatment. So let's look at a couple key things that they look at to start. So off the bat, they talk a little bit about what I've mentioned. They talk about how there seems to be research showing that there's abnormal levels of certain species in the gut. Specifically here, they talk about Prevotella copri, for instance, has been associated with the pathogenesis of RA. And they also show that transfer of P. copri to germ-free mice has been suggested to be sufficient to induce joint swelling in the model of spondyloarthritis. So it seems to be associated with different types of arthritis. And they have also shown that dysbiosis, so altered microbiome, in rheumatoid arthritis has been hypothesized to contribute to disease pathogenesis, as I said, by a number of mechanisms, including providing a source of citrullinated peptides, antigenic mimicry, activation of the antigen-presenting cells and T cells, and potentially by altering the integrity of the intestinal epithelium. And this is one that they're going to dive into a little bit more. In this next section, we can see they talk about how the integrity of the junctions in the intestinal lining, so between the cells, that's what keeps it from leaking. We have these junctions. It can be compromised by changes in the makeup of the bacteria in the gut, so this would be dysbiosis, or by inflammatory changes in the mucosal tissue, which can result in aberrant translocation of luminal contents into the mucosa. So basically we have stuff inside the gut getting outside where it's not supposed to be. And then similarly, dysregulated mucosal cytokine production, such as an increase in interferon gamma or tumor necrosis factor alpha, can reorganize or reduce tight junction protein expression, compromising gut barrier integrity. So these point to the two main things that they're showing are influencing gut permeability here. One is dysbiosis or an altered microbiome, and the other is actually inflammation, which is affecting the tight junctions and junctions in the intestinal lining. So those are the two key things that they've found which seem to be influencing it. And then we'll look at how this is playing a role in rheumatoid arthritis. Now we can see in this section here, it summarizes it really well. So in this study, they report that arthritis is accompanied by a loss of gut barrier integrity and altered leukocyte gut homing, and that correcting either of these can reduce the severity of arthritis. So we'll talk about this a little bit more. They basically found that specific immune cells seem to be homing to the gut and circulating throughout between the joints, the spleen, and the lymphatics. And this seems to be one of the key aspects where the problem arises. And they show that RA patients have increased serum levels of LPS, lipopolysaccharide. This is the part of the gram-negative bacteria that we know gets cycled around, is associated with gut permeability, LPS binding protein, and intestinal fatty acid binding protein, all of which are markers of intestinal damage and permeability, as well as a systemic rise in leukocytes expressing gut-homing markers, CCR9, and lymphocyte pair patches, adhesion molecules 1 or LPAM1, compared to healthy individuals. So again, there seems to be this shift in immune cells homing towards the gut, and we can see this on the various markers of the cells. They also showed that LPS binding protein levels were significantly increased in active compared to inactive patients. So active being patients with rheumatoid arthritis that are having current joint issues, so high levels of pain, limited range of motion, etc., versus those who are inactive, which may be relatively pain-free and without any symptoms. And they showed that the loss of gut integrity in RA is partially corrected with using a TNF-alpha inhibitor treated patients. So it seems that if we reduce the inflammation in the gut, that seems to help both with the RA symptoms, but also help with the intestinal barrier. And they look at this a little bit more in the mice model. And one important line from this here is they show that the development of arthritis is intrinsically linked to the development of gut permeability and inflammation. So this is no longer a correlational view of RA and gut permeability. This study is now showing a direct link between intestinal permeability, intestinal inflammation, and the pathogenesis of rheumatoid arthritis. So now we know if you've got RA, we need to treat the gut and we need to fix the gut. So let's look a little bit more at some of the specific outcomes in this research. So if we look at this here, we can see the measures of LPS. So we have the control, pre-RA, early RA, and then with RA. So obviously we can see a marked increase in the amount of LPS in the RA, but we also see even pre-RA it starts to elevate. Looking at LBP and the intestinal fatty acid binding protein, same thing. So we see marked elevations in actual RA when they've progressed through the entire disease state. So let's look at a couple of the items here now. So it's interesting when we look at the patients, as we talked about, so common treatments for arthritis such as NSAIDs have also been reported to increase intestinal permeability. So the typical non-steroidals that you get off the shelf, this is something that can not only damage the lining of the stomach, but also damage the lining of the gut. And previous studies have accounted potential use of NSAIDs in arthritis as the cause of intestinal permeability and why they said it may not be implicated. What's great is this study controlled for the use of NSAIDs. So they excluded anyone using NSAIDs in the patients, which allowed them to obviously remove that as an aspect, as a confounding variable. So we know that the intestinal permeability is caused purely due to either the inflammation or the dysbiosis or something else that they're looking at here, and not by the NSAIDs. So it's really important. And also a good side note, if you're using NSAIDs to manage your arthritis or joint pain, you might want to stop doing that. Not medical advice, of course. If we move to the next section here, what was interesting is there seemed to be a specific dose-dependent sort of response across the severity of symptoms in people with RA. So they found that all activity groups showed significantly higher levels of the three markers than the healthy controls. However, LBP was significantly lower in patients with intermediate or inactive disease compared to patients with active disease. And there was a trend for a reduction in serum LPS concentration in intermediate and inactive compared to the active. So it's a dose-dependent response. The more LPS, the more LPB, the more LBP we seem to see, the more severe your symptoms of RA. So obviously, the better we can manage intestinal permeability, the better your symptoms. And they showed that in the analysis of all RA patients, it revealed that serum LBP concentrations directly correlate with both DAS28, so symptom score, and CRP, a measure of inflammation, with the highest combined scores recorded in patients with the highest levels of serum LBP. Keep getting that backwards. So yeah, there's a dose-dependent response. The higher it is, the worse your outcomes in RA. So we want to get that down as much as possible. Now, the interesting part with this study is when they looked at the mechanisms in mice. So they actually dive into it to figure out what exactly is going on. So in mice, obviously, we can measure and test different things. So we can create intestinal permeability, or we get mice that have genetic susceptibility to it, and then we can use tracers and different things to measure the amount of permeability and then measure joint inflammation and various markers of arthritis. So this is exactly what they did. They got mice which were model organisms for leaky gut, intestinal permeability, and then measured what was going on. So you can see here that they did further assessment of gut barrier integrity by measuring the uptake of this orally fluorescent dextrin oral intake, confirmed an increase in permeability from an early stage of arthritis, rising to a peak at the height of the disease. So again, more permeability, worse outcomes with disease progression. And then the other aspect that they're looking at here was the homing of different types of cells. So again, in the mice model, they actually measured this, and they found that they showed that there were both arthritogenic cells and arthritogenic gut microbiota are necessary to induce disruption of gut permeability. So in the studies, they found that there were these specific cells, specifically splenocytes and other types of immune cells that seem to be circulating from either the joint, the spleen, or in the lymphatics to the gut, and then translocating and moving between those. So that seems to be a problem, and they said that this is a requirement, it's necessary for the disease progression to occur. So we need both the intestinal permeability and also the movement of these immune cells in order to enact the disease progression and severity. Again, they say here that these findings further confirm that arthritis development is accompanied by a loss of intestinal barrier integrity, and also show that the defect leads to systemic dissemination of bacteria, which could contribute to the pathogenesis of arthritis. So it becomes almost this feed-forward loop. So you're going to have something that caused inflammation or dysbiosis in the gut that leads to intestinal permeability, leads to more inflammation, more intestinal permeability, and we get this roundabout effect. So it's really important that we want to measure or maintain and fix any underlying issues with the gut in dealing with this disease. Now, one thing that was interesting, because they had the mouse model, they could test a couple new drugs that were looking at modulating gut permeability, specifically this one here, AT-1001, which is a trial drug for treating celiac disease. So they looked at using this in the arthritic mice, and what they found was it prevented the disruption of gut permeability, as shown by significantly reduced FIT-C dextrin uptake compared to untreated mice, and dramatically reduced joint swelling. So they saw almost an immediate effect with just improving intestinal barrier function. So again, that directly shows us a causative role of intestinal permeability in arthritis, specifically in rheumatoid arthritis, at least in a mouse model, which we can assume is what's happening in humans. So no longer correlative, and this is why this study was so good. They also say here that this was accompanied by a significant reduction in systemic and intestinal inflammation, as shown by decreased frequency of interferon gamma and IL-17 splenocytes. So those are the specific cells that were coming from the spleen. And by the lower levels of intestinal tissue damage, including crypt elongation and epithelial erosion. So some great signs here that it's obviously improving the function of the gut, and they saw an improvement in arthritis and in joint swelling. So direct outcomes. This study also looked at using a drug to block the recirculation of those specific cells to see if purely modulating the recirculation of those cells also influenced the disease progression. Because here, remember, they're stating that you need both the recirculation of those cells plus the intestinal permeability and inflammation. And what they found was that the use of this CCR9 antagonist, Persimon, significantly reduced joint swelling during the peak of disease in mice compared to untreated controls. So again, directly showing that if we treat these two mechanisms, we get a reduction in disease progression and symptoms. And one other thing that can be stated here is that with a lot of autoimmune type conditions, we usually see a shift in the T cells, specifically the Th1, Th17. We tend to get a higher level of those versus the Th2, and this is quite common. And they suggest here that there seems to be an effect where this increased pro-inflammatory state due to gut dysbiosis, intestinal permeability, etc., may be a factor influencing this transition to a Th1 dominant aspect in arthritis and many other autoimmune diseases. So it's just another aspect showing how the gut may be a main player and a main role in these types of diseases. All right, so hopefully that shows how well this study was done. We can now see not just a correlation between RA and potentially other autoimmune diseases with leaky gut, we now see a causative role both in human models and in mice models mechanistically. So we can say for certain, or pretty well for certain now, that gut dysfunction, gut dysbiosis, intestinal hyperpermeability, or leaky gut can be a cause of arthritis, rheumatoid arthritis, and potentially other diseases. And with the growth of all the other areas in gut research I've been talking about, gut-brain axis, gut hormone axis, etc., again, it comes back to the fact that we need to make sure we've got a really good, healthy gut and that we don't have intestinal hyperpermeability. So we want to take care of that as much as possible. All right, that's all I got for you guys today on this one. Make sure to hit the like and subscribe button if you haven't already, and that notification bell. If you want to support the channel, please do. It really helps out the algorithm to get these likes and subscribes in. Until next time, guys. See ya.